So now this topic is about art therapy and scientific basis of its effectiveness in trauma recovery. Now we firstly define what is the trauma. Trauma is a psychological response to deeply distressing the event. For example, it includes the abuse, the accidents, the violence, or natural disasters. Trauma can affect the emotions, behavior, memory, and the physical health. What is the art therapy? Basically, art therapy is a form of psychotherapy. It uses the creative activities such as the drawing, painting, and sculpting. It helps individuals express emotions that are difficult to put into the words, commonly used with the trauma survivors. Why the art therapy is used for the trauma? For example, why the art therapy is used for the trauma? It's include the trauma's memories are often stored non-verbally. Talking alone may not fully express traumatic experience. So art allows safe emotional expression and it reduces the emotional intensity and the stress. Now there is some scientific basis of the brain and the trauma. Basically, trauma affects the brain areas like the amygdala, which is the fear response of anything, hippocampus, which is the memory organ, prefrontal cortex, which is the emotional control. So, art therapy help to calm the brain and regulate the emotions. Now, the question is how the art therapy works on the brain. For example, art making activities both left and right hemisphere. It reduces the overactivity of the amygdala. It improves the emotional regulations. It encourages the healthy neural connections. Now the question is there is some scientific evidence of the effectiveness. For example, research show art therapies can reduce the PTSD problems, syndromes or symptoms, anxiety and the depressions. Study using brain scan the show reduce the stress responses. It helped to improve the emotional awareness and coping the skills. For example, trauma can art expressions will be emotional release and there will be the healing process. So now the question is art therapy process in the trauma recovery. Basically, it is the creating art, some emotional expression, some processing trauma safely, and some emotional healing and the recovery process. There is some benefits of the art therapy. For example, the first benefit is the non-verbal expression. The second is the safe emotional release. The third is to improve the self-esteem. And the fourth one is to reduce the stress and the fear and for suitable for all the ages. There is some limitations of the art therapy. For example, it required the trained therapist, not a replacement for all the treatments, and its effectiveness are varies among people to do. There is some types of the trauma treated with art therapy. For example, for the childhood trauma, for the post-traumatic stress disorders, for abuse and neglected wars and the refuse traumas, and for the natural disasters and the trauma. So there is some types of the art used in the art therapy. For example, drawing and sketching, painting, clay and sculptures, collage makings, coloring and mandala art. So what are the role of emotions in the trauma? Trauma causes the suppressed emotions. For example, common emotions include the fear, anger, guilt, and sadness. So, art provides a safe channels to release these emotions. Art therapy and emotional regulations help to identify the emotions. It improves the control over emotional reactions. It enhances the self-awareness and mindfulness. Art therapy and the stress reduction. It basically reduces the cortisol, which is the stress hormone, activate the relaxation response, and improve the mood and calmness. So there is some neuroplasticity and art therapy. Neuroplasticity is the brain ability to change. Art therapy promotes the positive neural rewiring, so it helps to replace the trauma responses with healthier patterns. Art therapy and the talk therapy. Talk therapy relies on verbal expression. Art therapy allows the non-verbal expression. So both can be used together for better outcomes. Art therapy in the children with trauma, like children struggle to verbalize the trauma. Art feel natural and safe for them. It improves the emotional expression and the behavior. Art therapy in the adult with trauma, it helps to adult process suppress the memories, reduce the PTSD symptoms, and encourage the emotional insights and the healings. So what are the role of the art therapy? Basically, it creates a safe therapeutic environment. It guides interpretation of artwork. It ensures the emotional safety and ethical practices. So, as a concluding marks, art therapy is an effective trauma-informed treatment. It has been basically supported by the neuroscience and psychological research. It helps the individuals heal when the words are not enough. So this topic is all about the trauma and the therapies used to treat these trauma, which is the art therapy.